Start off. I can see 57 people in the room. So welcome to the Africa Health Agenda International Conference press briefing. We're excited to have all of you join us today as we prepare and have our countdown, our 2-week countdown to AHAIC 2025 in Kigali, Rwanda. And today we're excited to have panelists who will be sharing with us some of the discussions that we'll be having in Kigali, Rwanda. We're very excited. The theme of this year's AHAIC 2025 touches on addressing socio-ecological dynamics of health. We are excited to be connected for change. This actually marks 10 years since our first AHAIC session years ago, and so very excited to be able to bring together prominent, eminent leaders from the African continent in Kigali to discuss social determinants of health. And so as we have our 2-week countdown, we're very excited to share with you that the agenda is ready and set, well curated. We have 5 plenary sessions. Each plenary session will unpack what we mean by socio-ecological dynamics of health. We will be sharing with you feedback, inputs, discussions from various African leaders, civil society, policymakers, governments, ministers of health, eminent public health professionals who will all be coming together in Kigali, Rwanda, to convene, to reflect, to share ideas, interventions that help Africa move forward when it comes to social ecological dynamics of health. And so the big question, I'm sure, in all of your minds is, what exactly are socio-ecological dynamics of health? And I have an esteemed panel that will be taking us through what we mean by that. They will unpack for us the definitions. They will unpack for us why it matters. They will tell us why it is important and pivotal for Africa to come together to discuss this. They will share with us how this will help Africa be healthier and prosperous as we continue moving towards the journey of universal health coverage for all African states and countries. When we deep dive into our plenary sessions, some of the things that you should expect would include hard-hitting conversations on climate change, the intersection of climate change and health. We'll be discussing what Africa is doing when it comes to adaptation interventions. We will be discussing climate financing. How far are we in reaching the targets that we need to be able to mobilize resources for climate and health and financing? We will be talking about what Africa is doing when it comes to the discussions that were held in COP29 and as we look forward to COP30. What is the space? What are the discussions? What are the controversial points that we need to focus on as we continue to rally and advocate for health for all in Africa? We will, of course, look at the global health architecture. We will discuss debt crisis. We will compare debt crisis and contrast it with economic growth. We will contrast debt crisis with health for all. Are we on track as Africa? What do we do to get the resources we need to ensure that our nations are healthy? Of course, we will also discuss health innovations. Are we leveraging enough on technology? And what is new in the African ecosystem when it comes to health innovations and technology? And how do these intersect with socio-ecological dynamics of health? And how can leveraging on health technology leap us forward to where we need to be when it comes to health outcomes for Africa? We will, of course, discuss health equity. Are we doing enough when it comes to the gender imperatives of health? Are we doing enough when it comes to urban planning? Are we doing enough when it comes to looking at the poverty levels in Africa and designing health systems that are responsive to the needs of Africa? And so it's a well-curated 4-day session in Kigali, and the countdown begins right now. And now I'd like to turn to my esteemed panel, who again, like I said, will help us define what exactly we mean by the socio-ecological dynamics of health. And I'm pleased to have Gerishom Gimayo, who is the Director of Health from the Rockefeller Foundation. I'm pleased to also have Dr. Onyango, who is the Director of Health, of Healthy Populations and leads a cluster that touches on NCDs, tobacco control, injury, healthy people. And she will have the answer for us on what we mean by socio-ecological dynamics of health. And then we have Godwin, who is a youth advocate who has been working in the space of innovations, and he will share with us how can we, as youth, how can we support our youth to be able to contribute to medical innovation in the continent? What barriers exist, and how do we unplug these barriers? And so this is a teaser for what to expect in the next 2 weeks as we all meet and convene in Rwanda, Kigali, for the Africa Health Agenda International Conference, celebrating 10 years on. And so to my panelists, and I'll start with Gerishom Gimayo. Gerishom, as the Director of Health at Rockefeller Foundation, how should we address the intersection of climate change and health? And what data supports our approach in tackling this challenge? Welcome, Gerishom.
I'm sure. Thank you so much, Dr. Mwangangi, and good to meet everyone. Again, my name is Gerishom, and I'm here with my colleague Umuliza Njiru from our communications team. Very nice to meet everyone. So definitely climate change is the crisis of our time, and it has a very significant bearing on health outcomes, including having the potential to erase some of the health gains that we have worked very hard over the years to achieve. When we're thinking about how we can work at the intersection of climate and health, I think I would like to say that the focus can be on three main areas. So one, working and concentrating on financing; two, concentrating on cross-sectoral collaboration; and then lastly, of course, ensuring that we use data to make sure that the health sector can respond to the climate impacts on health. And I'll go through each one of them. So looking at financing, the main challenge that we experience with climate financing as it is currently structured is that climate financing does not go towards adaptation, and even when it goes towards adaptation, it does not go towards health adaptation. We want to make sure that health systems have the resources and the funding to train the healthcare workers on how they should be responding to the climate impacts on health, to build strong health systems and resilient health systems that can be able to withstand the emerging and growing disease burden that is caused by climate change, to invest in health products and technologies, early warning systems, and other investments that are needed for the health sector to really be able to respond to this threat. So we want to ensure that the health system has enough resources, and we want to ensure that the health sector can be able to tap into climate financing that traditionally does not go towards health, and that the health sector has the capability and skills in being able to navigate the international climate finance space and unlock the resources that it needs to implement the programs, policies, and actions that are needed to protect the health of people from the climate impact. So that is one significant area that we should focus our efforts on. Another area I would say is making sure that we're not just focusing on the impacts here and now. The health sector is not just responding to the increasing malaria burden, the increasing cases of cholera that are being caused by climate change, but that we're also working with other sectors to make sure that the benefits that are realized in those sectors as a result of their investments in climate change are also recorded and counted towards the benefits that the health sector is achieving. So for example, if you're looking like at other sectors like agriculture, there's a lot of investments that goes into agriculture to make sure that agricultural and food systems are sustainable and are being implemented in a climate smart way. We want to make sure that the nutrition benefits that are achieved from those investments in agriculture also contributes to the health benefits that we are realizing on the health side. Similarly to investments in energy, so reducing emissions and air pollution. Similarly to the investments in transport transportation, making sure that we have a green transport system. We want to make sure that those benefits are also counted and realized as health benefits in terms of what we are able to do as a health sector to protect against the impacts of climate change. And then lastly, we want to make sure that health priorities are not just invested as a health sector, but are invested as part of broad government priorities as a whole. So health priorities are included in the mandates and investments that other sectors are making. And then lastly, on the data, we want to equip the health sector with the right data to make the right decisions around the climate risks that are facing populations, who is at risk, how are they vulnerable to that risk, what health impacts that climate risk is causing on health, and additionally and finally, what actions should be taken. So we want to build collaborations between health and other sectors, including meteorological sectors that really have precise data on climate risks and what risks those pose to health, so that the health sector can be able to position action, resources, protocols in advance to prepare for the upcoming increasing burden that will come from climate change. So we want to have a health sector that is driven by decisions that are driven by data and evidence on what climate change can actually do to health. I think working across these three big buckets of cross-sectoral collaboration, financing, and using data for decision making will enable the health sector to really participate and ensure that populations are resilient and populations are protected from the burden that is caused by climate change on health. Thank you.
Thank you, Gary, for that, and really very, very pivotal points you've raised when it comes to climate financing, when it comes to multi-sectoral action, meaning sectors beyond health, water, agriculture working together. Now, in AHAIC, we have our second plenary session. So this is perhaps the introductory plenary session, and it will be focusing on climate change. And I have the session right here in front of me. It's called Beyond Survival. So Africa's Plan for Evidence, Climate Policy Influence, and Local Leadership. Gary, as I move to Dr. Onyango, what can we do in AHAIC in the next 2 weeks when it comes to local leadership to raise advocacy on climate financing? How can we use the AHAIC platform to really, really, really draw in on this important subject?
I'm sure. Thank you again, Dr. Mwangangi. I think AHAIC provides a very good platform for Africa to consolidate across the investments that will give us the best return, and those investments that we can then advocate at upcoming platforms, and including in the formal climate negotiations that take place towards the end of the year. Last year at COP29 in Azerbaijan, Africa was negotiating for a basket of funding that will go towards adaptation. And I think the health sector being able to position what investments, what solutions, what interventions are locally developed will have the greatest return on investment, and that will also lead to the most significant health outcomes. We can use moments like AHAIC to surface those opportunities, investment options, and solutions that as a continent we can use as leverage when we're looking at negotiating for what investments should be made globally on the climate, on the broader climate space. I think articulating as a sector is one of the challenges that health has had. The way climate finance is traditionally allocated, it will go towards other sectors that can be able to make a very good case for themselves. And I think this is the moment for the health sector to also make a very good case on why we should be investing in health as a way to invest in the broader climate effort that we are undertaking as a continent. So I think it's a good moment for us to consolidate our ideas, our investment opportunities, and to be able to sit and negotiate on the negotiating table appropriately.
Thank you. Thank you, Gary. And as we move to Dr. Onyango, you lead healthy populations at WHO Afro, and you sit in the docket that really provides policy guidance, norms, and standards when it comes to social determinants of health. We have the recent occurrence of USG withdrawal in funding, a review process that's underway. We have Africa that's struggling with the debt crisis. We have pandemics and epidemics that are with us. Africa right now is still reeling from the Mpox epidemic. We are trying to control Ebola in certain parts of Africa, yet we hear that the financing basket is dwindling. So, what should we do? Where should Africa focus? What alternative models exist? What steps should be taken to ensure sustainability and resilience? Welcome, Dr. Onyango.
Thank you very much, Dr. Mwangangi, for the opportunity to speak on this. And I think let me just step back and look at what this the socio-ecological dynamics mean. When we think about our health challenges, past and present, they're rooted in an ecosystem in which people interact with people and with animals, and they act on the physical environment as they seek the air, the water, the food that is fundamental for their survival. The human-human and human-animal interactions can be harmonious or disharmonious, and the human action of the physical environment can be sustainable or unsustainable. And that defines a lot of what we are seeing as time changes and climate changes, how we are able to cope, how we are able to, what happens in our social relations that define equity, equality, questions of inequality, health as elsewhere, questions of engagement, questions of agency of the people that we are concerned about, whose health we are concerned about. So that social dynamic, socio-ecological dynamic is a very, I think it's an amazing moment for us to be talking about that, because also the crisis that we are experiencing, financial or other, are linked with precisely this, the human to human interactions, what we understand as what brings us together and what separates us. You speak about the challenges we're facing right now with the withdrawal of USG funding. WHO is a member state, mostly should be a member state funded organization, which means every member state, including the smallest country on the continent, contributes towards towards the budget that WHO depends on. And so at a time like this, it's a question of looking back and saying, what do we actually have? What resources do we have? And how can we use those resources in a way that still addresses the challenges that we have, the priority challenges that we have, that we save lives, that we enable human beings, we enable people to thrive, to grow, to thrive, and to advance in the circumstances in which they find themselves. So actually, what we're doing in this secretariat is exactly what everybody does when they suddenly find that the income they had been counting on is no longer there. We have to look inwards and see, what do we want to prioritize? We have to look inwards and see, what resources do we have that we did not even realize we had? And for a region that is as challenged as we are with economic poverty, and yet a lot of possibilities in terms of natural resources that we can tap into, that we can harness to contribute to our development, this is the time to look at that and say, how do we deal with this using what is at hand, using our social systems, engaging communities in ways that value ever more the knowledge, and the coping mechanisms that they have developed over time in order to maintain harmony when they interact with the environment in which they live, in order to maintain harmony in those interactions that they have between one another, the solidarity. So yes, we do have huge challenges with emergencies. I mean, we're talking about a current situation where in 2024, the region was faced with 20 graded emergencies, and they required significant operational responses. We had 9 disease outbreaks, 11 complex humanitarian crises, driven by conflict and climate-related disasters. So, I mean, we come back to where do we find ourselves and where do we need to look? We cannot continue to look to the same sources that we looked at. I'm very glad that there's going to be time to discuss opportunities to tap into finances that are being generated in areas that are not health, because health is considered as a social investment and not a profitable investment. But in fact, when you think about it, when you want to look at some of the basics that drive health, water, sanitation, people are paying to draw water in jerry cans, huge amounts of money. But those who have the funds to invest in water systems may be thinking, oh, if we invest in communities and in the health sector, we're not going to get any profit from this. But they can profit from that because those who are paying for very poor quality and unreliable supplies of water will pay for more reliable sources, better quality water, so water, for example. The same thing with energy. So actually, the opportunity to look at what wealth we can mobilize within our own modest means is an opportunity that this challenge is posing for us. And that is a question that we have to look at as an institution, as institutions. It's not just WHO that's affected by this, but also as the communities that are the primary, at the front line. The crises begin in the communities and end in the communities. We bury our dead in the communities. So it's very important that we look at the community resources that we can harness in a time of crisis like this.
Fantastic, fantastic. Thank you, Dr. Onyango. And, just to really reiterate what you've said, it's communities defining paths of self-reliance. It's us looking at our own internal resources. It's governments looking to see how they can raise domestic resources. And I'd like to pose a similar question that I posed to Gershom. What about the intersection of climate change and health? What perspective do you have from WHO, and how can we use the AHAIC platform and moment in the next 2 weeks to advocate for more resourcing in the intersection of climate change and health?
Okay, thank you very much. Actually, at AHAIC 2023, we were on a discussion panel. We were on a panel with several people, including the UNF, somebody from UNFCCC, the UN Framework Convention on Climate Change. Yeah. And we started a conversation that was like, let's get the health sector, the ministers of health actually, more engaged in the UNFCCC processes. And it was also the year when we had the health day, the first health day at the COP28. It was key that we actually had a lot of ministers from the African region or high-level representation participating in the COP28 in Dubai. And thank you to Rockefeller Foundation. It was one of the funders that supported that process, as well as the Wellcome Trust and I think the Global Fund. So we got ministers to go there. It's actually an ongoing process where we're now pushing for ministers to take the leadership, not just by participating in those global processes, but also internally in their own countries. The ministers of health need to engage with the ministers of environment, with the ministers of finance, who are the ones who are responsible for coordinating the proposals that countries put forward to try and tap into climate financing. We need our health sector leadership to be on the table to define the indicators for health that need to be taken into account when we're discussing what should we be doing in order to improve adaptation, mitigation, etc. Resilience building. We need to find ways of measuring resilience so that it can be taken into account in the discussions around what needs to be supported. Then it actually has enhanced that engagement to the point where we are now able, we're working, WHO Afro, that is, working with ministries of health to try and put together adaptation fund proposals. This is a new area of operation, and we're still facing a lot of difficulties because those funds are not easy to access. There are a lot of barriers to them. And we have seen that with other funding mechanisms, which they may be there, but the process, the way you have to write the proposal for you to tap into it, into those funds is very complex, too complicated for most of the resources that we have on the continent. And then we have to go and unlock the funds once they come. How do you make them work and make them work in a way that is really going to address the challenges? That means that, and again, we're working on this, getting the health sector also to participate in the process of the NDC definition. Suddenly I forget what NDC stands for, but I hope that
the nationally determined contribution.
Exactly. So we are working with ministers of health to say, let's make sure that it features there so that so actually we are moving into this space in ways that we haven't done before. And I think necessity is the mother of invention. We have to go and do this. Thank you.
Fantastic. Thank you. Thank you, Dr. Onyango, for really sharing some tangible interventions that are underway at WHO Afro. And we hope that these will filter into the AHAIC conversation and that we will mobilize a community that really will support unlocking of funds for the health sector when it comes to the intersection of climate change and health. Now, Godwin, the fourth plenary at AHAIC is titled New Tools for New Challenges, Harnessing Innovations for Health Equity. And you are a young man who's an innovator. And so could you share with us how we can leverage on local resources, the manpower of the youth, who have potential, of course, to develop vaccines, medications for endemic diseases? How can we support and invest in local talent to drive medical innovation? What do we need to ensure that the discussion looks like in the fourth plenary of the upcoming AHAIC conference? Welcome, Godwin. Godwin, I hope you can hear me. You can unmute. Fantastic.
Can you hear me now?
Godwin, I can't seem to hear you. Okay, great. I think there's a connection issue. Could you try again, Godwin? And this is why we need your innovations.
Well, I can hear you. I can hear you.
So clearly you can hear me, but we can't hear you. So maybe you could work on the back end and IT can support you. And I'll do a little pivot back to Gerishom as we get support for you so that we can hear you. And so, Gary, as we look at socio-ecological determinants of health, you did mention to us that there's need for us to really bring together different sectors when it comes to determining the benefits that can accrue to the health sector with investments in other sectors. Could you share with us and give us some examples of what this could look like and how AHAIC can shape conversations on really being able to count on the core benefits of investment in other sectors? What should we be discussing? What should we be focusing on when it comes to the issue of core benefits?
Sure, and thank you again, Dr. Mwangangi. And spring from where Dr. Onyango left us. The way countries organize their climate action writ large is around their nationally determined contributions. So what constitutes a country's plans or voluntary contributions in terms of the commitments that a country has shared that they're going to do towards tackling the impacts of climate change is consolidated across different sectors. So the health sector, the agriculture sector, the environment sector, the transport sector pulled together what are called national adaptation plans. And through these national adaptation plans, countries are able to articulate what actions they will be able to take. So working towards a process where health priorities are integrated across the other sectoral plans. So if you're coming together and putting a national adaptation plan in agriculture, you make sure that you have included health indicators, health priorities, health interventions, and health benefits that you would want to achieve in the agriculture sector that will have a benefit for health, and so on and so forth across the other sectors. Being deliberate, being strategic, creating a process where you have clearly articulated programs and priorities that can be measured, and you will be able to realize those results across the different sectors. At AHAIC, the conversation should be how then do you make sure that these health priorities are considered in those other cross-sectoral plans and measures and investments that they will finally make. Health sector has visibility in terms of what other sectors are doing, discussions on how to engage with those sectors, how to make sure that health sector is on the table in those other discussions, but also making sure that you are picking out what specific measures, core benefits we would like to achieve from the other sectors that will result in benefits for the health sector. Being strategic and mapping out that process at a conference like AHAIC, where we are bringing together very broad health sector and other sectoral expertise, will be a significant way to do that. And then we can follow the process of being able to leverage financing that is coming to other sectors, and that will then have core benefits for the health sector. So I think AHAIC presents a good opportunity to just have this landscaping, to develop plans of action, to bring other sectors also to understand why should they care about health. Again, in many of these conversations, it's usually done, it's usually preaching to the choir. So health sector only brings people from the health sector. The agriculture people are not on the table. The environment people are not on the table. And efforts have been made over the past couple of years to break those silos or verticals, but being more intentional in terms of which tables the health sector is sitting on, and who else also we are bringing in to our conversations to also understand why they should care for the health sector priorities and how they can integrate them in their plans and actions as they are developing them. So having that sort of partnership discussions and dialogue opens up the opportunity for how the health sector can engage post the conference.
Thank you. Thank you, Gary. So again, you're emphasizing that this is about partnerships, this is about collaboration, this is about being very intentional and deliberate. You've repeated that twice. Can we be more intentional in these conversations? And, you know, Gary, we have an anonymous attendee who's skeptical, and they've posted a question in the question bar, and they say that given the failure to allocate 15% of national budgets to health, what alternative approaches are there when it comes to defeating the climate crisis and climate change and intersection of health? So are there alternative approaches? Are you telling us, Gary, that what you see as a solution is the health sector being more present in UNFCCC conversations, or are there other alternatives? Is there a role for the private sector? Is there a role, perhaps, is there a magical wand that can help us mobilize more resources?
I'm sure. So I'll stick on the issue of partnerships. I think the health sector is a sector that has been very fortunate to have a lot of partnerships and to receive a lot of support from the global community. But because of that, I think the health sector has not been very efficient in terms of how it utilizes the scarce resources that it has available to it. So I think the first step before asking for more resources is looking at within the basket of funds that we have available, are we being as efficient as possible? One of the jokes that is often made about the health sector is that in a health budget is one that can be short of 10 billion. They ask for 10 billion, they're given 5, but they'll not come back to ask for more money. And the reason the health sector will not ask for more money is because they either overcosted or asked for more than what they needed, or that they are able to find other support to be able to run their programs. So we want to make sure that as we are planning as a health sector, we are being very intentional about the resources that we already have available to us. We can also lean into partnerships with non-traditional partners, including now this conversation that we are having in terms of how to make sure that the health sector can be able to tap into climate finance. We can tap into partnerships with the private sector. Private sector will want to know where their return on investment is, and if they invest in health systems, health commodities, health products, health equipments, how will they be able to realize a return on them? So making sure that the health sector creates these partnerships and leverages these partnerships where they cannot directly make investments themselves. They can be able to make to realize benefits from the investments that are made by other partners. I think those are the two contributions that I would make: being more efficient with what we have, and then looking for more partnerships, including with non-traditional partners, in terms of how the health sector can better work and collaborate with those partners.
Fantastic. Thank you. Thank you, Gershom. Now, Godwin, do we have a thumbs up? Do we have our microphone working?
Does it work now? Can you hear me?
Fantastic. You did it, Godwin. You solved it. Young innovators. So could you share with us, in the upcoming AHAIC conference, how can we invest and have conversations on investing in local talent? What do we need to do to drive medical innovation in the continent?
So thank you for the honor of having to speak on such high-level panel. We must say thank you to America Health Africa. It's one of the things we talk about as young people who want to be in the room and contribute to these really salient conversations that have young people who are fortunately so contribute to one of the largest working force across the world. Africa's youth population are the largest in the world. And then having these young people or representatives of them come into the room to give their own insights, their own perspectives of the way things are happening in the world. So I must say, firstly, thank you so much for the opportunity. And in respect to the conversations around having young people innovate and contribute to, I would say yes, innovations in respect to the medical field and the development of vaccines, and then looking at emerging trends in the public health space. So I'm going to be a bit biased. Yes, I understand that the health sector is very important. Yes, health is literally all that there is. But then there are also the economic parts to it, and which is why I think the theme for this year's conference is very, very profound, because we're talking about socioeconomic dynamics of health. And when we talk about the social dynamics of health, we're talking about what I would say what caveats are there that affect the youth population, because, for instance, we're talking about access to quality healthcare, and we're talking about access to quality healthcare, also talking about equity in healthcare services. There needs to be an economic basis for young people to be able to access these quality healthcare services. I was speaking with a friend 2 days ago. There was an application for young people to come in to give innovative challenges to solve problems in climate change and health. And when we looked at the eligibility status and the kind of innovations that were required of us young people to put forth to compete with the global world, it was really mind-boggling. Why? Because there are certain there's a certain level of knowledge young people are supposed to have access to for them to be able to innovate. I will take, for instance, the little issue I had, technical default I had with my speaker, my microphone, I could not speak earlier. Say, for instance, if I did not have access to basic education, if I did not have access to maybe a telephone or a mobile phone or a laptop before my speaking today, it really would have been difficult for me to be able to solve this in good time, right? So it's the same with healthcare. For young people to be able to innovate, for them to be able to contribute positively and profoundly to the challenges that we face these days, there needs to be access to economic stability. And that's where education also comes in. There needs to be health promotion in respect to the literacy level of how aware are young people of the issues that we face. And I think Dr. Adet Onyango, please, I'm so sorry if I mispronounced your name, but she said something about the challenges that we face, the crisis starting up in these communities and the crisis ending in these communities. But I dare say that the solution are also in these communities. So I am sick, I know I have a problem, then I can give a solution to it. I can't be helped if I don't speak up. I can't be helped if I do not even know what my problem is. So most of the time, yes, I understand that there's a need for aid, there's a need for foreign help or investment in Africa. But I dare say that the solution is with us because we are the ones who face these challenges. Not necessarily us, but there are rural communities, there are marginalized groups that in communities who most likely will not even say have access to healthcare, quality healthcare services. There are communities that do not even have basic access to electricity. So sometimes, yes, I know AHAIC is going to happen in March, but then how do we as young people, say we attend, how do we extend these learnings or information we get from the conference down to these local communities who do not even have access to make travel or who do not have access to devices to get the salient information that we need? So for me, it's going to be on two fronts. First is access to economic and socio-economic I would say, resources to be able to seek out this useful information that they need to solve healthcare challenges. And the second is going to be on the education front. So yes, there should be economic stability, but there also needs to be access to quality education. There needs to be awareness. The public health space has evolved now. The way we solve public health or the way we address public health challenges are different. I would say kudos to Africa CDC. The way we handled Marburg, the way we handled Mpox was completely different from the way we handled COVID. So yes, there are learnings from the way we've handled public health concerns in the past concerning that, given the fact that the climate is also changing. Because of these learnings, it doesn't just end with us. Yes, we solve these challenges, but how do we ensure that these learnings, these solutions that we see are now lesson learned that have been cascaded down to the rural communities? Because they are the ones who suffer the most. Yes, urban communities may also suffer the challenges of climate change or lack of access or maybe high price quality healthcare services. But what do the rural communities have access to? It's worse for them. So how do we cascade down the learnings that we get from AHAIC conference coming up in March 2nd to 5th, and then other learnings from whatever solutions we find? How do we cascade this down to the rural communities? So that's it for me. So access to economic stability, and then education, and then cascading down all of these lessons learned down to the rural communities. Thank you.
Thank you. Thank you, Godwin. And, you know, like when I started, I said, you know, this panel will define for us what we mean by socio-ecological dynamics in health. And Godwin, you have hit it out of the park. It's about economic opportunity. It's about young people. It's about looking at communities and how we interact together. And really, what AHAIC presents is a convening platform to ensure these pivotal conversations are held. And most importantly, that these conversations then translate into illustrations of tangible interventions that can take place on the ground. And so I do agree with you. Post AHAIC, we do need to continue the conversation. We do need to ensure that the conversations that will be held in the next 2 weeks do translate to action on the ground. Now, I just have about 12 minutes to go, and I do see a question again from an anonymous attendee in our chat. And Dr. Onyango, I think this question it has your face on it. And they say that vaccines have become the preferred method of managing epidemics, pandemics, and diseases like malaria. However, some countries have successfully controlled malaria without vaccines. What is the rationale behind prioritizing vaccines in Africa? Why is there an influx of vaccines in the region?
Okay. the vaccines, they are a method. I don't think they are preferred as a method. There are vaccine preventable diseases that can be properly controlled through vaccination, but there are others that require the combination of that. So vaccines are one line of intervention, but there are many other measures that need to be part of the package of what happens, because if you're doing vaccines but not doing anything else to improve the health of the people, to improve the economic conditions in which they live, the living conditions that perpetuate disease, you are not going to solve a problem. So there are, because if we're not able to prevent through a vaccine, there are a whole host of other methods that can be used to prevent disease. And not all diseases are vaccine preventable anyway. So when you're looking at the holistic picture of health and well-being, vaccines are but one. I wouldn't say that they're being prioritized over everything else in our approach in Africa. But for areas where we have struggled in terms of controlling, for example, the malaria vaccine, which is being introduced, it's because we've struggled a lot with the control of malaria, and it's killing a lot of people. So it's important to look at a combination of methods that can control diseases of that nature.
Fantastic. Thank you, Dr. Onyango. Now, I just have one final question before we wrap up our session today, and it's really hearing from the panelists. What does the future of health look like in Africa? What are the key things that we need to focus on as African leaders, stakeholders, when it comes to the health sector? Paint for us a picture on what we need to do, and then the future that you hope for Africa. And we'll start with you, Gary.
Sure. Thank you, Mercy. I think as a continent and as a call to action for leaders and health stakeholders on the continent, we need to be more ambitious. We have currently been working primarily with support of external partners, and we need to be able to realize the ambitions that we have set as a continent and have more self-determination as a continent. So that is one. And then two, I would say as an additional area is we need to move from making political commitments to having tangible actions. As a continent, we have had very many declarations that start with the Abuja Declaration that one of our colleagues has mentioned on the chat on increasing health allocations as part of the total government expenditure to 15%. Only 2 countries so far within the continent have been able to realize that mark. We need to move from political commitments, whether it is Abuja, whether it is Abidjan, whether it is Lusaka, to actually put our money where our mouths are, to move from commitments, to move to action, and to make sure that we are realizing the potential that we have. So in terms of imagining what the next couple of years should look like, I would say prioritizing, converting the understanding where there's a very good general understanding of what we need to do to actually making the right steps in terms of achieving the action and ambition that we have set as a continent.
Thank you, Gary. So really having the theme of self-determination and self-reliance when it comes to the African continent. Dr. Onyango, what does the future of Africa look like?
I would say that, let me cite the general program of work of WHO, which is beginning to be implemented right now. Our first priority is promoting health. And I think it comes from a realization that we have shifted so much to defining health as the absence of disease, even if in all the parlance we say it's not, that we celebrate the opening of a tertiary hospital, but we don't celebrate the setup of a water sanitation system in a village. Yet, what we're going to achieve in terms of health returns by investing in the conditions that promote health and preserve health is a lot more than what we get from being able to go for treatment, as we have a proliferation of serious non-communicable diseases, the rate of cancer, the cardiovascular diseases, strokes, the mental health issues, all those things that are linked with lifestyle. It's very important that we step back and think, what can we do to preserve the health that we have? So the prevention the promotion of health as a good that most of us are born with, and the thinking about health systems beyond health facilities. Because when we talk about primary health care, we're talking about homes that are clean environments for children to play in. We're talking about a mother being able to put their baby to the breast and to breastfeed them for at least 6 months without any need for anything else to come into it. Those policies that make it possible to preserve as much as possible what we already have are going to be critically important for us, especially as we realize that when we wait to get sick and be treated and define that as a functioning health system, we are actually leaving a lot of people behind who do not have the means to, as our young Godwin told us, the access, the economic means to access those things are not there. So let's preserve what they have that's in their own hands, in our own hands, to be able to remain healthy. Thank you.
Thank you. Thank you, Dr. Onyango. I love what you said, health beyond health facilities, and I'll borrow that in future. And really, to you, Godwin, what does the future look like? And Godwin, we're still on mute. I'm sure it has innovation. The future has innovation. What else does it have?
Yeah, so am I clear now?
Yes.
Yeah, so for me, I would say the future is now. The future is now because the future generations will consider my future as their own present. So the future is now. And for me, the answer is clear. The time to act is now. We are not waiting for the future. We are creating it right now. And that means Africa's health agenda is in our hands. And together we want to drive the change we want to see. So for me, young people, we are not just the future of Africa's health agenda. We are the driving force of change today. And we're leading the charge for a healthier and more climate resilient continent. So in that light, it's that we as young people must collaborate, because I would always say collaboration is the new innovation. So we can't do it alone. So if young people today would want to be future public health leaders, or want to see a continent that's more climate resilient in the healthcare space, I would say we need all the collaboration we can get. Young people should be brought into the rooms, not just brought into the rooms, but we should be given a voice. We should be given a voice, we should be given a seat at the table where we can air out our own perspectives, because you don't know the pain of someone unless you are in their shoes. So for we young people, bring us into the room, let us speak our hearts, let us speak the heart of these vulnerable and marginalized communities, and let us co-create the future now. Whatever future we want to see in public health, in the healthcare space, let us begin to co-create that right now. So for me, that's it. So let's create the future.
Thank you. Thank you, Godwin. The future is now. Let's collaborate. Let's come together. Let's co-create. And so thank you, fellow panelists, for really sitting with us through this press briefing for the Africa Health Agenda International Conference 2025. Our countdown begins now. We will be convening in Kigali on the 2nd to the 6th of March. We have a jam-packed agenda. We start with a walk for change, and then we deep dive into 5 plenary sessions that really will unpack for us what the socio-ecological dynamics of health look like. And I do thank you all really for shedding more light into this space, for helping us all understand what socio-ecological dynamics of health means. And I would also like to really appreciate some of the confirmed organizations, individuals who will be coming together in Kigali. We do have confirmations from Rockefeller Foundation, Gates Foundation, Wellcome Trust, Skoll Foundation, Serum Institute of India will be there, UNICEF will be there, Pfizer will be there, Abbott will be there, MSD, Roche, GSK, Global Health, IDRC, Nigeria Health Watch will be there, the End Fund will be there, Women in Global Health will be there, Water Aid will be there, Living Goods will be there, Wild Bicycle Relief will be there. We have Africa Frontline First, who will also be there. Elsiva, Goal 3 Rwanda, Movement Health, Skills Medication, Vital Strategies, Cord Aid will be there. And so we really do welcome each and every one of you to come and convene around the African tree in Kigali as we discuss the Africa Health Agenda. Thank you for joining us for this briefing. Thank you. Thank you, everyone. Thank you, panelists. See you. Thank you.